Would you give spinal anesthesia to a patient with such a rash on her back? Well, before jumping on to a yes or no, let's talk about what the patient is. She is a 26-year-old female coming for an emergency LSCS because of fetal distress. Now, you are working in a limited resource setup with no ICU backup with you, so you would like to avoid general anesthesia in any case possible. You do not have any person backing you. This rash is actually because of a contact dermatitis because of a hair dye. That is why the area that you can see in between, which is covered by the blouse, is devoid of any rash. That is why you have a particular segment where you can actually attempt doing the spinal, but that spinal area is a thoracic area. So you're either left with a thoracic spinal for this pregnant patient or a tailor's approach, because you can see even that particular area for the tailor's approach is also devoid of that rash. So you can go either for a thoracic or a tailor's approach or a general anesthesia but without ICU setup. What I did was I did the thoracic spinal anesthesia with a hyperbaric drug 1.8 ml, made the patient sit for 2 to 3 minutes and then actually made her supine. You can also make her supine immediately, but remember it can be high spinal very quickly, so you have to keep the patient head up at 30 to 45 degree at least if you want to make it quick. And if you have a isobaric drug, that is best because you can give a thoracic segmental spinal then, but then you should know how to give it, how to calculate and give the isobaric drug. So if you were at my position, which of these above technique would you have preferred? A thoracic segmental spinal if you had isobaric, a thoracic segmental spinal with a hyperbaric alone, or general anesthesia, or the Taylor's approach? Let me know your answer and your approach. Let's discuss in comments which is better and which is not.